among the human beings. What is the cause? What is the implications with this diabetes that we always hear that many other people are really suffering with? And to kick off with our conversation, it's a good pleasure to have you, Dr. Brian Mutebi. Thank you for joining us in the Coffee Break conversation.
Thank you so much. Pleasure is mine.
How is Mengo?
Mengo Hospital, we are saving lives.
Amen.
And we request all Ugandans to come to Mengo Hospital for adequate screening, especially for the non-communicable diseases. Recently, we launched our NCD Center, and we want to invite everybody with all the non-communicable diseases, hypertension, diabetes, to come to Mengo Hospital. Asthma, come to Mengo Hospital, be diagnosed. You'll get very good treatment and care at Mengo Hospital. Amen.
Maybe to kick off with our topic discussion, the topic we have today, living with diabetes. What is diabetes in your own perspective as doctor?
I'll try to break it down so that our people can know and understand the disease or the condition properly. Diabetes is an endocrine disease. Endocrine meaning it comes from an organ that produces hormones, and that organ is the pancreas. So it is an endocrine disease that causes too much blood sugar in circulation, and this usually comes in when patients actually have inadequate insulin production. It can either be relative or it can be absolute. That is for patients who have majorly type 1. But also it can happen in type 2 patients, type 2 diabetes, whereby we have insulin resistance because of sedentary lifestyle, obesity, predisposing some of these patients to having diabetes mellitus. Yes.
Maybe tell us what are the most common types of diabetes and you see among the Ugandan patients?
Oh, thank you so much. That's a very good question to ask. But I'll reply it this way. Diabetes has quite a number of types. We have type 1 diabetes, which we used to call diabetes of the young or juvenile diabetes. We also have type 2 diabetes, which accounts for about 90 to 95% globally of the cases of diabetes. So you see, it's one of the major kind of diseases, one major type of diabetes that actually is affecting majority of the people globally, but also locally here in Uganda. But also the other is the diabetes that usually comes during pregnancy. It's called the gestational diabetes. Yes.
Maybe you can give us a picture. How does this come about? How do you know? How can you tell that a person has diabetes? What are the signs and the symptoms? Maybe at the early stage, do even the young children have them, or is most especially for the adults?
Yes, as I said, diabetes has other many types, but I've talked about type 1, type 2, and gestational diabetes. But we have the new type that has been developed recently by the Uganda Diabetes Association called type 5 diabetes. But the children actually can get diabetes, so it's called type 1 diabetes. The children, the teenagers, the young adults can actually have diabetes. But type 2 diabetes, as I said, accounts for about 90 to 95% globally, looking at the different types of diabetes. Some of the symptoms that patients actually present with when they come with diabetes, they are what we call the classical symptoms of diabetes, and those are the 5 Ps and the 3 Ws. The 5 Ps they're a bit medical, but I'm going to break them down. Number 1 is polydipsia. Polydipsia meaning excessive thirst. You feel thirsty during the day. It's a bit hard to tell because you're up and about, drinking this, drinking a soda, drinking this, drinking some juice, some smoothies. So it's a bit hard to tell that you're actually having a problem. But you start to notice a problem when you can't sleep because you're always waking up at night to sleep. And actually some patients to take water. Some patients actually they have jerry cans at their bedside. They wake up, they take. So someone can take in the night about close to 5 liters of water just in the night. So that's when you start to notice that there's a problem. So that's number 1. There's a polydipsia. Number 2, it's polyphagia. You want to eat all the time. Everything that comes by, you are eating pizza, the next time you're eating a burger, the other time you're eating chips, nyama choma is there, you're eating it. the hunger centers are very active, and
yes,
you're eating
yes.
all the time. Yeah, of course, the third clinical feature of diabetes, or the other sign that you can look out for, is pruritus. Pruritus meaning itching. So there are, of course, very many different types of different causes of body itching, but that can be one of the other factors. You feel your body is itching generally, and then the other is polyneuropathy. You feel pricks, pins and needles, burning sensation, mainly in the feet, but also it can happen in the upper limbs.
Okay.
For the men, this goes out there for the men. So if you see you're having challenges with erection, if I put it that way, you know that there's actually a problem. That is diabetes, because that organ gets functional if it is filled up with blood.
Yes.
And because diabetes affects blood vessels, there's going to be challenges with filling that organ with blood.
Okay.
So you have challenges with your family. Yeah. So erectile dysfunction is very key. Okay. Polydipsia, as we have said, polyphagia, increased hunger, neuropathies, and then the other W's that we can talk about are weakness. You feel weak all the time. You go to the hospital, they check for malaria, they check for typhoid, they check for infections. All those things are negative, but for you feel weak all the time. Okay. Of course, there are other reasons that can cause other things that can cause weakness, but that can be one of the other symptoms. Unintentional weight loss. You've not put up a plan to reduce weight, but you've been 100 kgs, then out of the blue you're 60, out of the blue you're 30, out of the blue you're 90, within a short span. So weight loss that is unintentional, weakness and wasting, they are the classical symptoms. But I want to remind you that and the audience that diabetes actually affects the eyes. Okay. So it's one of the leading causes of blindness. It affects the eyes. So visual issues, blurring of vision can actually be one of the first signs of diabetes, among the others, as you have seen.
How about the young children? How do you predict, how can you tell that this child is having diabetes?
Yeah. For the children, still those symptoms cut across of the different types of diabetes. So the student you still see a child that they have failure to thrive. Okay. You expect children to achieve certain milestones and they are not achieving them. You expect them to achieve certain weights and they are not achieving them. They have still unintentional weight loss. Still, that too much drinking will still be there, even in the children. The weight loss, the too much drinking, the thirst, the frequent urination in the night or nocturia is one other classical symptom that still cuts across in patients who come in with diabetes. Yes, for both type 1 and type 2.
We'll talk about the women who are pregnant. Has this also affected the babies, or is kind of different?
Thank you so much for that question. Women fall in a very unique category. Having gestational diabetes means that we are diagnosing this condition for the first time in pregnancy, and this usually happens between 24 to 28 weeks of amenorrhea when the mother is pregnant. 24 to 28 weeks. Okay. Yes. So they still present with the same symptoms, and does it affect the baby? Not directly. Okay. So a mother having gestational diabetes does not mean that the babies will actually have diabetes. However, what the complication that the mother can have is that usually, because they have a lot of glucose in their saturation, they tend to produce babies that are actually oversized, 4 kilograms and above. So some of those babies, because they are used to environments where there is a lot of glucose, so when they come out, you find that they are depleted of glucose, and their sugars, when they come out of their mother's wombs, their sugars drop and they can even die because of very low blood sugars. So oftentimes you see a mother giving birth to a baby who's 5 kilograms, and the doctors are rushing the baby to the nursery, and the baby is big, and the mother is complaining, why are you taking my baby to the nursery? All babies who are who are big, they should be admitted in the intensive care unit and closely monitored. The other complication that the mothers have, of course, when a baby is big, chances are high that the mother will not be able to push this baby.
Okay.
They can get challenges during delivery. So they have to have the operations done, you know. So I still advise all Ugandans out there that come to Mengo Hospital, and we have very good antenatal services. We shall screen for all these conditions, and we shall be able to catch them early, put you on treatment, and then you will be okay. You live very well. So mothers who come in and they have started on treatment, and we've noticed that they are having gestational diabetes, there's treatment for it. They give you treatment. You give birth to babies who are normal weight because the sugars are under control. But that happens if mothers attend antenatal adequately. Yes. But then, and they don't deliver from home.
Great. When we look at the managing diabetes among the patients, how is it like in the daily life?
Managing diabetes among the general public, I will first put a comment to that before I answer that question. Diabetes is a global burden. And you know, in 2021 it's projected that about 531 million people actually had diabetes, and it's projected about 634 million people will have diabetes by 2030. So you see the numbers are going to actually keep growing. So it's a very big concern. So the management of diabetes is number one, we need to make sure that people are aware that there is a problem. And it's a very big problem when you look at the numbers. There is a problem of diabetes, so people need to know, and that's why we are here to tell the country that there is a growing problem of diabetes in the country, in the sub-Saharan region, but also globally. And the treatment of diabetes is actually wide. You know, it's wide, but it stems from, in the order below, it stems from lifestyle modification, reducing weight. People who are obese, they have to make sure that they cut down on their weight. Cessation of smoking. We are not even talking about drugs. Number one, it starts with us. Even before you get the disease, you need to make sure that if you are obese, you have to make sure that you cut down on the weight. You have to be very active. You have to make sure that you do physical exercise every day. For people who do who are working, who are employees and they are working, you oftentimes fail to get time to actually do this physical exercise because you have to wake up very early from home. You get to your car, or you get a taxi or a boda, you go to work, and then thereafter you leave work late, maybe at 9, you're very tired, you want to rest and then prepare for the next day. So you find they don't have enough time to do physical exercise. But I would advise that for those who drive, make sure that you park a distance from where you work, so that you walk to your workplace. If there is a lift, don't use a lift, use stairs to your workplace. All that physical exercise is very important, because you don't have the time. Instead of getting you food in your office, go down to the cafeteria and eat from there, and then climb up the stairs back to your workplace. That is one of the other things that we talk about in terms of physical exercise. Reduce weight, do physical exercise, stop smoking. Stop smoking, and then to reduce on the alcohol intake. If possible, stop it. Alcohol also has a lot of effects on the body generally, so stopping it would be a bonus to you. Avoiding junk food, avoiding alcohol, eating healthy, eating our local dishes, our matoke, our sweet potatoes, our posho. All that food is actually very healthy in terms of preventing diabetes. For some of the patients who are actually having diabetes, those we have to discuss the meals. Of course, we adjust here, let's reduce on the grams that we take here, let's take off this, let's take off that. Yes, so lifestyle modification, weight reduction, and then of course you need to make sure that you screen for hypertension. So hypertension has to be screened for and then treated. And then lastly, we look at controlling cholesterol. You have to come to hospital, you get your cholesterol checked, and then it is you're put under treatment. And then lastly, the drugs come in to treat diabetes. So you see that the drugs, I'm talking about the drugs as the last option.
Mm.
So it all starts with us improving our lifestyle,
Yes.
avoiding sedentary lifestyle, cutting down weight and managing obesity, stopping smoking and alcohol, and also checking what we eat, but also checking what we give to our children. You find that some of us are very healthy and we are eating a lot of good things, but our children are eating a lot of junk.
That's right.
And the assumption is, my child is just 2 years, 3 years,
They have the heavy weight.
The baby is actually getting type 2 diabetes because they are very obese. They are eating burger all the time and pizza. So even the children, you have to teach them from the young age that these foods are healthy, that we eat our local dishes, and they should embrace it so that we fight obesity as a country and as a nation.
When you look at Ugandans, meaning we have many misconceptions about living with diabetes maybe. Have you ever had some of them, and how have you tried to address these misconceptions about that?
Yes, thank you so much. There are quite a number of misconceptions about diabetes, or myths about the disease, and especially its management. About the disease, people actually know that not many people, those who know, they know that diabetes is a very disturbing problem or disturbing disease. However, most of the challenges we get them for actually patients who are suffering from the disease. And sometimes we sympathize with them because they come to Dr. Mtebi at the NCD center at Mengo Hospital, and Dr. Mtebi is telling them, you're going to be on these drugs for life. And then they go somewhere and the herbalist is telling them, you take this jerrycan of herbs, it is going to cost you 5 million a dose, and then you're going to be okay. And then someone weighs being on medicine for life vis-a-vis taking a herb that is going to cure diabetes. So I want to emphasize today that diabetes does not cure actually. There is only one type of diabetes that cures.
Which one is that?
And that is the diabetes that happens in pregnancy.
Okay.
Called the gestational diabetes. So when a mother gets diabetes in pregnancy and it's happening for the first time and they have not had diabetes before, that diabetes will cure.
Why does this and others do not? What is the difference?
The difference is that usually some of course there are other risk factors for those mothers.
Yes.
It comes with obesity, they have been smoking, they have been these things that we talked about as the risk factors of diabetes. But also there's a genetic predisposition that you find that not every mother gets diabetes. Some get, some don't. So there's a genetic predisposition. But also hormones that happen during pregnancy, there's progesterone and other hormones that are released that actually can potentiate diabetes in mothers. So after delivery, these hormones, the surge goes down, and actually the disease actually clears. However, going back to the misconception about the disease, I want to urge the general public that living with diabetes diabetes is manageable. So a patient, or if you're out there and have this problem, seek the experts and get yourself screened and checked for hypertension. Let them check your cholesterol, have your eyes checked, have your kidneys checked, have your cholesterol checked, have your feet looked at. All those are very important things. And then they start you on treatment and management of diabetes. Can I say the herbs work or they don't? For the few patients, for the many patients I've treated, I've not seen patients who have done well with herbs. I'll be very honest. Some of them come with hypoglycemia because they are using both the conventional medicine that you're giving them together with the herbs, and then the sugars drop. Others come with complications. They have taken these herbs in line that they are going to actually help control or take down the diabetes, but they end up getting liver disease. And then we are battling with diabetes, now the liver disease because of the herbs that someone has been taking. Those we have received a number at Mengo Hospital. They come in, they have been on herbs, and the kidneys are sick and the liver is sick because someone has been on herbs. So I recommend, before you go to that herbalist, come and seek the guidance of the physicians. Let them see you, assess you, and give you adequate treatment. All these things, akakomera, cow's urine, cow's dung, those things, all those things don't work. So come and seek the experts. It should come from the doctor to tell you that, okay, maybe looking at the way the things are moving, I think you're undergoing remission, because some patients can go in remission. Not necessarily that they have cured, but they can undergo remission. Or you're actually honeymooning, meaning that the sugars, you had diabetes, maybe the pancreas had gone to sleep, and then for some reason when they start treatment it wakes up and then everything goes back to normal. But those are really a handful. Those are very few people who go into remission. Those are few people who get honeymooning. Allow me also comment that patients who come to hospital and the doctor tells you, they do the thorough investigation, they examine you, they take history, they do laboratory investigations, and the doctor says, we are going to start you on insulin. Insulin means they're injectables. It's a drug that would otherwise be produced by the pancreas, but you're giving it to you through an injection. So many people don't like injections. Many people don't like injections. But I will say that insulin is one of the drugs that has been shown to help control diabetes. And the earlier we initiate someone on insulin, the better. That insulin, especially for type 2 patients who come, type 2 diabetic patients who come to hospital, and we start them on insulin early, the chances of progressing to complications such as kidney disease, peripheral artery disease, blindness are very minimal, because this insulin is going to rest the pancreas, it's going to sort out your blood sugar that is very high, and then you're going to find that everything, the body is going to go back to almost its normal physiology that it had before. And after about 3 to 4 months on insulin, then we can switch you back to the tablets, and then you will do very well, what we call the legacy effect. So I urge that you have a discussion. Of course, sometimes we oftentimes don't coerce patients, but oftentimes when you come to us, we have a discussion with you. We have a management plan. We don't really coerce, but we sit down, we see what is going to work and what may not work for you as a patient. Yes, but also we are mindful that of course some people, we are living in Africa. You find that some people, their children are already grown and they are working, and maybe they are staying home alone, maybe with grandchildren and maids, and you may find that this person may not be able to use the insulin well because of their visual problems. So all those discussions come in, and we look at other alternatives that we can use instead of the insulin. So we guide and we advise on the way forward, depending on how the patient presents to us.
You've given us some of the types, maybe to make us understand, or the types you're giving unto us, which one is more risky, and have you encountered some cases of death of some patients because of this disease?
Thank you so much for that question. Diabetes, regardless of the type, for as long as it is diabetes, it can cause serious complications. And that's one of the reasons why we are actually here. It can be very catastrophic, regardless whether type 1, whether gestational diabetes, whether it is type 2, whether it is type 5. All those can actually be catastrophic. And the reason why we are concerned about diabetes is that it can lead to complications. It can lead to complications. And among the complications that diabetes leads to is blindness, what we call retinopathy in our field of medicine. So it can lead to blindness. It can also cause amputations because of reduced blood flow, and that is one thing that people actually know majorly. That, hey, you're suffering from diabetes. They are going to cut off those legs. So when some people start getting wounds, they are worried that they may get an amputation. So it's definitely a concern. We don't want our diabetic patients to get wounds, and we still advise them that when you come to hospital, the doctors we check those patients thoroughly from head to toe, and we make sure that we screen for those kind of complications to see that if they are there, we treat them, and then we see how we can mitigate some of these challenges that they come with. So diabetes can cause kidney disease. Kidney disease can later lead to dialysis, which is very expensive. And not many people can afford dialysis.
That's right.
So for us to prevent patients from progressing to kidney failure and later needing dialysis, we have to make sure that we start early. And the starting of early is early awareness of the general public, and also making sure that our healthcare providers are aware about the burden of the disease. They get information about the complications, how we can screen for these complications quickly. Recently, as Uganda Diabetic Association, we have come up with point of care screening tests for kidney disease, and we're trying to see that we distribute them in majority of the hospitals and in government hospitals to see that these patients, we screen them for kidney diseases early, we catch them early, we treat them, and then their way of life improves. Because if someone is going to be on dialysis, they will need a minimum of about $1 million per week. You know, that is very expensive. It's very expensive, especially in sub-Saharan Africa. But even the way of life of these patients is reduced. So we are worried about the blindness. Everybody wants to see the light.
That's true.
You want to see your children. You want to see the good place where your daughter coming from the US is taking you.
Yes.
You know. So all those things are very important. So we want to avoid visual problems, heart-related problems, kidney problems, or kidney failure, heart failure, blindness, and then amputations.
You mentioned about that this disease has no cure, should we say? Then how is the process of recovery? Like, you can tell for how long does it take for a patient who is having this disease? Like, there is an improvement. For how long does it take according to the treatment that you give unto them?
Usually, because the driver of these complications is hyperglycemia, or the driver of the clinical presentation, or the symptom that this patient present with is very high blood sugar. When the blood sugars drop, the clinical presentation that we talked about, if you remember very well, the increased urination, the increased thirst, the weight loss, the erectile dysfunction, those are directly driven majorly by too much blood sugar. So when the sugars come to normal levels, symptoms like blurring of vision will improve. The too much urination in the night will stop. The increased thirst and hunger will go. The weight loss and the gaining of the weight, that will take some bit of time. But these early symptoms will clear when the sugars drop and they go back to normal levels. Yes.
For how long does it appear? Does it have a period of time, or it depends on how patients are responding to your directives and doctors?
It depends on how the patient responds to the treatment that they are taking. There are patients who come to us and we start them on insulin, maybe with some oral tablets, but maybe insulin or oral tablet, whichever that we decide to start with. So those patients whom we start on those treatment, the symptoms may not go in the first week, you know, because the sugars are maybe still high. So that's why all patients who come to hospital, if you're there and you're diabetic, you need to have a glucometer, because you're not going to be seeing this doctor every day. But if you have your own glucometer, you do what we call self-monitoring of blood glucose from home, and you can tell that, hey, I'm taking this medicine, but the sugars are still 15, they are 20, they are not going down. So patients usually come to us to answer the question. We start them on treatment, and then we give them a short review, usually 5 days to a week, as they are monitoring their sugars, and they come back with their blood sugar log, and we see how can we adjust this, because it may not be that when we start them on treatment they are going to improve immediately. It takes time. It may take a week for some patients. Others may take even months. Maybe they are still trying to play around with the different regimens so that their sugars stabilize.
Let's look at the rural area and the urban areas. Which of the two has more cases of this disease?
I will start by saying that over 50% of patients don't, over 50% of our general population, of people having diabetes don't actually know that they have diabetes. Because the symptoms are not yet there. Sugars of fasting sugar of about 7 to 8 in the morning to 9, it may not actually give you those symptoms that you've just talked about there, but you're actually diabetic. For you to start having those symptoms, your sugars should be very high, ranging from above 14 going up. The symptoms start to develop. So if it is 12, if it is 10, if it is 9, if it is 7, you may not actually have those overt symptoms. So someone may have diabetes for years, unknown. By the time they come to hospital, they have complications, or they are having what you call a diabetic ketoacidosis, and maybe having a diabetic coma, and they need to go into the ICU. So yes, those patients, we have to screen them, especially those who come to hospital, but also we are trying to see that we reach out to those patients out there and create awareness.
So it doesn't matter, the rural or urban, most of them do not know that they have this disease.
Most of them don't know. But if I'm to give the statistically, the urban areas, it is almost 50-50. But type 2, as we said, 90-95% of patients actually have type 2. But because it's really linked to sedentary lifestyle, the urban population, we see there's more diabetes in the urban than in the rural areas. Yes, because of the lifestyle. Because in the rural areas, people walk to work, they walk to the gardens, they walk to their farms, they cycle. But here someone is driving. He's seated, and then he's going to the office with the AC, and he's going to be there the whole day seated. So diabetes, if I'm to compare the urban and the rural, you'll notice that the urban areas actually have a high prevalence of diabetes as compared to the rural areas.
Someone will be asking himself or herself a question: does taking too much sugar cause this disease? Then also overseating, someone overseats and they experience maybe the legs, they kind of
become swollen.
Yes, and we can highlight that a little bit.
Yes, I'll start with the last one. Sitting for a long time, of course, is sedentary. It puts you at a risk of having diabetes. At a risk. So you're just at a risk, meaning you may not. However, sitting for long actually can, in one place for a long time, can actually predispose you to other fatal conditions, such as clots in the legs, because you're seated in one place for a long time and the blood is not moving adequately to go back to the heart from the legs. So the chances of you forming clots in the legs is very high. So for that person who is sitting most of the time and they're having swelling of the legs, they have to be very careful. If they have one of the two legs most swollen as compared to the other, it may be an indicator that they could actually be having a clot in their legs, what we call a deep venous thrombosis. Yes, but also that's why we really advise that if patients if you're going to move out of the country, you're going to take a trip for 18 hours, 14 hours, make sure that you move, make sure that you ambulate. Don't sit in one place for a long time. People moving from long distances for over 8 hours in transit, have breaks, move out of that car, walk around, to prevent you from getting these conditions. But being in one place, that of course is coupled with poor health, poor eating habits, those can actually predispose you to diabetes. Those are risk factors. Yes.
And for the sugar part?
I beg your pardon.
Taking too much sugar, does it also cause this?
Taking too much sugar does not necessarily directly cause diabetes. It doesn't directly cause diabetes. But of course, we advise that, the other risk factors that we've talked about are the ones that directly drive diabetes. Yes, but carbonated drinks, if someone takes a lot of them, there are people who take sodas on a daily, every day, and they take sodas every day. The amount of sugar that you're consuming is too much. So the chances of you developing diabetes is very high. Yes. I would still advise that person who's taking a lot of sugar, reduce on that sugar. They reduce on that sugar. It is just going to give you tests. It's not going to add much. Yes.
Lastly, as we're coming to an end, how can families and communities support our patients living with diabetes?
how can families and communities
support these patients?
Yes. Importantly, diabetes affects families. So it is one person who is sick. However, the whole family is involved in the care of this person. So number one, as Uganda Diabetes Association, we are trying to see that we fight stigma. Fight stigma in patients who have diabetes and the general public, that it's okay to have diabetes. It is treatable. You can't spread it. It is non-communicable. You can't transmit to your children. You can't transmit to others. So families, they can give support to these people by taking them to hospital, buying for these patients glucometers, encouraging them to eat healthy, and encouraging them to monitor their sugars adequately. Yes, the general public, I think the general public just needs to be aware that there is a problem of diabetes in the country, and they should be on the lookout. When you go to hospital, even if it is malaria, have your blood pressure checked, have your blood sugar checked. It's important. As Mengo Hospital, we made that rule that all patients who come to hospital, regardless of what has brought them, we screen them for these non-communicable diseases. Because when we catch them early, we start on treatment quickly or early, and we put up measures to see that we prevent complications that we have talked about from coming.
Okay. Yes. Thank you so much. I think we have come to the end of the program. That has been Dr. Brian Mutebi, the resident physician from Mengo Hospital, and we're looking at the disease which most of you think maybe that you aren't having, but you could be having it, yet you do not know. So early interventions and finding out the signs and symptoms he has given unto us, go for the medical checkup at Mengo Hospital. They'll be able to give you whatever you need, and you live a healthier life. Remember, it is manageable, it has no cure, so the earlier the better for you to have a sustainable life. My name is Ritah Nandera. Allow me to wish you. Yes,
I want to give parting remarks, but I want to remind the general public that November is a World Diabetes Month. And we shall be commemorating World Diabetes Day on the 14th of November. And as Uganda Diabetes Association, the association where I belong, we shall be celebrating World Diabetes Day in Shema district. All people of Shema, Mbarara, Ruhare, please make sure that you come. Even all those around, come and celebrate with us, and come and we commemorate with us. But also come as we create awareness about diabetes.
Okay, let us wish you a blessed Tuesday. See you then. Bye-bye.